This video will orient you to the Canadian Performance Exam in Dental Hygiene, which will be referred to as the CPEDH throughout this video. The CPEDH is a two-part performance-based assessment delivered over 2 days. The design is meant to evaluate clinical competence of candidates by assessing knowledge and/or skill at an entry to practice level in both a simulated-based setting with standardized clients and in an authentic clinical context with actual clients. The CPEDH will evaluate a broad range of clinical skills and issues such as a candidate's ability to obtain and interpret data, critically apply problem-solving skills, and communicate and manage a variety of client behaviors. Together, parts 1 and 2 of the CPEDH are constructed from 10 competency-focused clinical scenarios known as stations. For each station, you will encounter a realistic dental hygiene scenario in which you are required to perform one or more tasks. The 10 stations feature different client types that present the most important and/or frequent client care situations based on the CPEDH blueprint. The CPEDH competencies include professional and client relationships, health and safety, assessment and diagnosis, planning, and finally implementation and evaluation. More information related to the client types and frequent client care situations can be accessed in the document titled Consensus Definitions for Competencies and Client Types for the CPEDH. A link to this document and the CPEDH blueprint were sent to you in an email from the CRDHA. You may also access these resources on the CRDHA website. Part 1 of the CPEDH is delivered on day 1 and is approximately 3 hours in length, not including registration and orientation. Part 1 consists of 7 simulation-based stations that mimic clinical situations using a standardized client, a mannequin, and/or a written scenario. Each station will involve a new standardized client interaction and/or problem requiring you to demonstrate a different set of competencies. Each station includes a standardized set of equipment or materials as warranted by the case. Part 2 is delivered on day 2 and is approximately 4 hours in length, not including registration and orientation. Part 2 consists of 3 stations involving 3 independent clinical interactions. These clinical stations are similar to the simulation-based stations, except they take place with actual clients and include a specific intraoral assessment and clinical therapy. The June 2019 examination will take place at the University of Alberta K. Edmonton Clinic, which is located at 11400 University Avenue Northwest on the 8th floor in Edmonton, Alberta. Parking is located on the west side of the building. For further information, please review the information on the Alberta Health Services website at www.albertahealthservices.ca/parking. The CPEDH is scent-free. Please refrain from wearing any perfumes, colognes, aftershaves, or other scented products. Part 1, Day 1. When you arrive at the examination site, please check in at reception. Here, you will be directed to the locker room to change into your clinical attire. Clinical attire consists of scrubs, closed-toe and enclosed heel shoes, protective eyewear, and hair must be cleaned, well managed, pulled back, and fastened. Once you have changed, you will be directed back to the registration desk where you will be required to show your valid government-issued photo identification, which includes driver's license, passport, or other government-issued identification. You will be issued with a CPEDH identification tag with your photo and unique identification number, which must be worn during the duration of the exam. Upon registration, you will be asked to sign a non-disclosure and consent form. And you will receive candidate identification number labels and a customized copy of your own schedule, including the starting station for day 1. You will be asked to hand in all your personal belongings, including electronic devices. Following check-in and registration, you will be required to attend an orientation session that reviews Part 1 of the exam processes, interactions with raters and exam staff, physical facilities, station processes, and finally, information on available instruments and equipment. The 7 simulation-based stations are organized in a circuit in numerical order. Each case involves a new independent simulated client interaction and/or problem and assesses a different set of competencies. Candidate instructions provided in the case stem are posted outside of each station. Upon arrival at each station, you will present your candidate ID to the rater for verification and provide the rater with the requested number of candidate ID labels for that station. After which, you will wait quietly outside the station with your back to the candidate instructions. When you hear the audible signal, you will have 5 minutes to read and familiarize yourself with the candidate instructions found on the posted case stem. The audible signal will sound to indicate the following: start and stop of the transition times, preparation times, and station completion times. You will have 15 minutes to complete the tasks of each station. A duplicate copy of the candidate instructions is provided in the station for review if necessary. An announcement will indicate when you only have 2 minutes left at the station. You must remain at the station for the full 15 minutes even if you are completed earlier than the allotted time. If you complete the station early, you can wrap up by saying thank you to your standardized client, then sit quietly without engaging the standardized client or rater for the remainder of the time. If you recognize that you forgot to complete a portion of the station task, it is acceptable to inform the rater of this and then complete that portion of the task during the remaining time. After the completion of one station, you will have 2 minutes to transition to your next scheduled station rotation. Individual candidate timetable provides the station rotation schedule specific for you. If you are unsure of your next station rotation, exam personnel will be available to provide directions. Once your candidate ID has been verified and you have provided the required number of candidate ID labels to the rater, you will stand with your back towards the candidate instructions until the audible signal indicates the beginning of the 5-minute time frame for reading the entire case stem. This process will continue until all 7 station rotations have been completed. Upon completion of all 7 station rotations, you will be escorted to the reception area. At reception, you will be required to hand in your labels. Sign out. And collect your personal belongings in order to change prior to leaving the facility. If you have not demonstrated a minimum level of competence in Part 1 of the CPEDH, you are not permitted to participate in Part 2. You will receive an email from the exam administrator in the late afternoon on day 1 providing this information. On day 2, upon entering the facility, you will again be required to change into clinical attire. Once changed, you will go to the registration desk where you will show your valid government-issued identification in order to obtain your CPEDH identification tag and candidate identification number labels, after which you will turn in all your personal belongings. On day 2 of the examination, there will be 3 actual client clinical stations that include 3 independent and clinical interactions. Upon entering the station, the rater will verify your identification and you will give the required number of candidate ID labels for that station to the rater. Overgowns will be supplied at each station. You are required to don a new gown for each station rotation. You will be required to change your overgown prior to transitioning to the next station. The audible signal will indicate the start of your 60 minutes to review the case and complete the tasks of the station. The clinical stations in Part 2 include 3 independent clinical interactions. Each station will take place with an actual client and includes specific intraoral assessments and clinical therapy. The required tasks of the station are on the candidate instructions found on the case stem. The rater will provide written instructions for the assigned area for each clinical station on the form titled Clinical Notes with Tooth Designation. You will have 60 minutes to review the case and complete the tasks of the station. There will be an audible sound letting you know that you only have 5 minutes left at that station. You must remain at the station for the full 60 minutes even if you are finished early. After the completion of one station, you will have 15 to 30 minutes to rest and transition to the following station. This is depending on a client's need for pain control. You will be required to rotate through all 3 stations. The timing for Part 2 of the CPEDH is as follows: 60 minutes to review the case and complete the tasks of the station, followed by 15 to 30 minutes to transition and rest between stations. This process continues until all 3 station rotations are complete. Upon completion of the 3rd rotation, you will be escorted to reception. You will be required to hand in your labels and sign out. You will then collect your personal belongings and then change prior to leaving the facility. You will receive a report with information about your performance approximately 4 to 6 weeks after the CPEDH. For more information or any questions about the CPEDH, please visit the CRDHA website or contact us using the telephone numbers provided on this screen.